In June, Gujarat experienced a notable rise in respiratory and seasonal infections, leading to a significant surge in the sale and use of medicines. Data from PharmaRec shows that sales of anti-infective drugs rose by 71% in June 2024 compared to the same month 5 years ago, nearing the level of sales seen during the peak of COVID-19 pandemic. Thus, we spoke to the physicians as what kind of diseases are prevailing in this seasonal shift. Namaste, you're watching Vibes of India and I am Flory.
In the last June, we have seen tremendous increase in number of patients consulting as well as hospitalization. The reason behind it is sudden change in temperature. There are also few waterborne diseases which were very prevalent in last month, and we are also seeing the beginning of the season of mosquitoes, so that because of this sudden change of temperature we are seeing many viral infections. Because of adulteration of water, we are seeing many waterborne diseases like cholera, typhoid, food poisoning. There are many patients of diarrhea vomiting who are coming in extreme dehydration to the hospital, for whom we need to admit them. And in the month of June, we are also seeing few cases of falciparum malaria, dengue, as well as rare cases of chikungunya. So dengue and malaria, those cases have started increasing suddenly in the month of June. So in last month, we are seeing the number of outdoor and indoor patients. The figures or the numbers are comparable to that of COVID. In COVID months, we have been flooded with outdoor and indoor patients. We were extremely occupied in hospital in indoor and outdoor forms. The doctors were difficult to find. In last month of June, we are seeing the similar situation. What can we do for this? We can definitely improve our hygiene. We can improve the level of sanitation. There are also number of vaccines available for foodborne and airborne diseases, like there are vaccines available for influenza and there are vaccines available for rotavirus and cholera. So if we can increase immunization, if we can increase hygiene, and if we stop eating outside or street food in those months of monsoon, we can definitely see some improvement in getting sick or being hospitalized.
At present, we are getting seasonal variation point of view. We are getting a respiratory tract infection because of that hot climate and the humid climate, and changing from a climate means remaining in AC environment and then going out of AC and eating some cold food also, chilled food. That is leading to respiratory problem like upper respiratory tract infection with cold, cough, throat pain and fever, and some waterborne diseases are also there, mainly gastroenteritis are there.
There is lot of fluctuation of temperature is seen over last 15 days in Ahmedabad. Sometimes it is very hot, sometimes it is cold, sometimes it is very humid, sometimes it is raining. Because of this fluctuation of this temperature, we are seeing the patients mostly present to us as a complaint of fever, nausea, vomiting, dehydration, giddiness, muscle cramps, loss of appetite, loss of interest in the works. So there are different presentations of the patients with different symptoms that we are seeing. And we have seen the patients of the diabetic blood pressure, there is also a fluctuation in their blood sugar level as well as their blood pressure levels. So because of this humid and fluctuating weather, we are seeing different kind of the patients over last 15 days. And most of the times we advise patient as a symptomatic treatment as well as to do full rest and take plenty of fluids, liquids to prevent dehydrations and other symptoms.
Well, whether it's a seasonal disease or not, Vibes of India advises you to take care of your health and stay safe. Till then, keep watching Vibes of India.